the combo care or combo unit, when it's turned on, it goes through a 6 or 10-second boot process. Now it's on. So you're going to make contact with the patient using their pads. I'm using 2. Now I'm using the other 2. I'm just putting them random. You can use either 2 or 4. The only reason why you might use 2 is if you're treating one area or you're doing ultrasound in combination with the stim. So the first thing you want to do once the machine is on is you want to use button number 1. The machine actually has a cheat sheet that you can use, and it goes through all the parameters with each button. Button number 1 is the choice where you can select the type of treatment. And button 2, once you choose your button number 1 treatment, button number 2 gives you the settings or the presets for the treatment that you chose using button 1. So we hit button 1 and then use the little dial here, and you can see the dial as you're turning it right to left. It goes through the different treatments that you have, and there's only a few treatments to choose. IF is interferential using 4P or 4 pads. And then you have interferential using 2 pads. And when you see this right here is showing you 2 pads, it gives you a little diagram indicator. It doesn't show 4 pads for some reason when you have interferential 4P, but just know that it'll put the juice or electricity into all 4 pads. Now I tested it using IF2P, and for some reason you'll still get the electricity into all 4 pads, so I don't honestly know the difference between the 2 yet. And then you have Russian stim, which is a special type of muscle re-education. If somebody has partial paralysis of a muscle, it's supposed to be like doing weightlifting, only an external stimulation, not the brain stimulating the muscle. Not a parameter that we'll ever use here, I don't think. And the next one is TENS. Something else generally we're not going to use. The next one is EMS. That's a good one too. So basically we have interferential or EMS that we can choose from. So, and then it cycles back to the first one. So right now we're on interferential 4 pads, and since I have 4 pads on here, you go to the second button, and that gives you P1. Now P1 basically you have here is a parameter that's a preset. Now let's go to where it shows the difference here. So the difference between P1 and P2, I'm going to cycle between that. Yeah, P2, these are the different presets. Pause it a second. So P1, or any P, 1 through, I don't know, 8 or 9 or 10 channel choices, P is considered the common program. It only has 1 treatment dialed in. The other one, let's see if I can figure out how to get there. Pause it a second. So now, once you have the B2 where you're in the setting for a common program, which are presets, you can toggle between 10 different presets. And I'm going with default out of the box, staying with 1. And then once you have this where it's on P1, unless you want to play around with any of the other presets, you just start raising the intensity. These are the buttons here, and I'm doing them both at the same time. Now I'm starting to feel that in my left arm. And right now it's pretty strong. And you can see my arm is kind of contracting a little bit. Maybe you can't see that, but I can feel it. Now the treatment time default is 15 minutes. Now this button, which is B7, button number 7, you can change the time. Now I'm going to stop the treatment, and I'm going to act as if we never went in there, because I want to show how you can actually change using this switch here. The default is 15 minutes. I'm going to put it down to, let's say, 5 minutes. And then you don't have to do anything other than just start treatment, and you go into the intensity of the treatment. And again, you dial in how intense you want to do it. And you always ask the patient to let you know, when do you feel it? Let me know. You go a little stronger and say, I'm going to go a little higher after they first feel it. Tell me when to stop when it's comfortable but strong. You don't want any contraction. You don't want any twitching of the muscle in their upper back, lower back, wherever you have those pads. Make sure the patient is really comfortable. So right now I feel it, but it's not pulling my muscles. It's just it's a comfortable stim. And you can see the treatment time is dialing down. Now, this button also acts as a pause. I just pause treatment and it slowly ramps away. If you need to do anything, maybe place the pads in a different place, maybe for whatever reason you need to pause treatment. And it's also a resume button. You press it and it doesn't shock them. It's slowly ramping the treatment back up. And my arm is moving because I could feel it coming back. So you never get shocked by this machine. Nice safety features. Okay, so I'm going to stop this treatment. That's the stop button anytime. It just completely stops it. Now I'm going to go back to this button, which is the selecting the program. Now this is flashing. So that was interferential using 4P or 4 pads. Same thing with 2 pads. I'm not going to show that because it's pretty much the same. Russian stim, remember I said you skip that. 10s. Now EMS is something that maybe you want to do because it just has a different treatment. It goes a little bit deeper. And I'm going to increase. See, that one was on 5 minutes. Now, as you're increasing the intensity to the treatment area, the timer is already going. Now, you have the option to do one region at a time, and once they feel it, maximum intensity, then you just go ramp up the other treatment area. I like to do both. So now, see my hand? Now, EMS, I can tell you that it has a burst mode, a frequency, and an amplitude, and a duration. See that? So basically what happens is interferential is a constant voltage, constant intensity to a certain area, whereas EMS, it has a waveform where it's ramping up to the maximum and then it slowly fades away, and you can preset all the parameters, a relaxation phase, and then in a ramp up or a maximum phase, a minimum phase. So it really is a good treatment, but you have to determine what the doctor wants you to do. And I'm going to stop that. This also should be 10 or 15 minutes. And my arm is just going and going, and then it fades away. Now, in order to change, I'm going to go ahead and stop this. So now I showed what it does and why it does it. It's almost like getting a massage or a workout. What you can do when you're on EMS is you can, when it's on P1, you can change it to P1, P2. These are presets. You see how the frequency is 200 hertz or cycles, 120. You have burst mode, 5 hertz. Duration, 60 milliseconds, 100. Basically, this is setting all the dialed in presets from the factory. And the thing to remember with EMS, the way it's working here is, as opposed to interferential, which is constant flow of juice and it doesn't vary intensity or frequency or duration, this has a lot of presets that allow you to apply the therapeutic dose on a ramping up and ramping down application. And the presets will allow you to do that. Now, we're going to go back to button 1, which takes you back to the screen where you can choose what you want to do. Now, so we have also button number 8, which should take us, let's see if we can get to ultrasound. Okay, now, when you see this icon here, right now we are in ultrasound treatment mode only. No electrical stimulation. So you're going to be using this device right here. Now, I'm going to put a little bit of gel on the treatment area. Not much, but I want you to see, at this point, we're on 50% duty cycle. Now, you should know by now that ultrasound, you can vary the application mode in terms of how intense and how often. Ultrasound goes from 1 to 2 million cycle per second sound wave. It's a very high frequency sound wave which mechanically stimulates the muscles and the tissues. It applies healing that way. But 50% in this case means that for half of the time In other words, every few seconds the sound wave will turn off, turn on, turn off, turn on, so that when you have intermittent application of the treatment, it means that you technically shouldn't be able to harm, damage, or burn the patient. When it's on 100%, you have to be careful and always keep moving the sound head. It's a good idea to move it anyway. The proper technique is to be moving it all the time anyway. So now we're in P1. Let's see if we can... So 50%, 1 megahertz. Okay, so when this is flashing, you can change it. And what you do, let's see here. Yeah, you can put it on any percent. I don't know why anybody would put it that low, because, you know, that would only... This basically means that if you do 5 minutes of ultrasound, only 10% of that time is the device going to actually be applying the therapy. The other 90% of the time, the device turns off, but it alternates it. So if you go up to 100%, I'm going to go ahead and leave it there. And I'm going to go ahead and start the treatment. Now, you also want to turn the treatment intensity. That's the time. I'm going to leave it on 5 minutes for right now. So we're going to... let's see, how do we get to here? I think the way that we raise the treatment intensity is just by doing this. Now, what's funny is, if I put that up, and I go up to 2. Now, I want you all to see, before I do anything, you have to watch for this diagram, this little icon. Can you see it in the camera? It shows you the icon of the ultrasound head, but there's a little radio signal, kind of like a Wi-Fi signal that's going to come out on top. As I'm raising the intensity, it shows you that means it's on. Now it turned off because there's a safety feature, and this green light should be solid when you're doing the treatment. But if you do not touch the skin, there is a safety feature built in to the ultrasound where it is, and this is how they word it. Let's see. They are wording it this way. Combination, where did I put that? Just take 2. So the ultrasound has a safety feature built in, wherein if you try to increase the treatment up to a certain intensity, it automatically shuts off. It has a load detection, and an alarm buzzer will sound if the intensity value is too high. So I'm going to go ahead and put it on my skin. Now the button turns solid green. Excuse me, the light. The light is now solid green. Now if I take it off, it should start flashing, which means it automatically shuts off. Now, and you can see this is flashing without the little Wi-Fi signal. Put it back on, the light turns solid, and there's your Wi-Fi signal. And I can actually feel that. So we know that this is working. So the timer is going down, the duty cycle is 100%, frequency is 1 megahertz. That can either be 1 or 3. There's only 2 choices as far as I remember. And there you have just ultrasound. So now we went through just electrical, just ultrasound. Now we're going to do combo. Pause. I'm going to stop the ultrasound. And what we're going to do is go back to button number 1, which should give me my parameters, my treatment parameters. And let's see, I'm going to hit this twice. So now it's stuck in ultrasound. Here we go. So now I'm back in my main screen where you can dial in the different parameters. Now, the difference being, now we have a symbol at the top that shows you the 2 electrical pads tied in with the ultrasound head. This is the icon that tells you, or tells me, that we are in combo mode. So you can apply ultrasound along with your 2 pads, even though I have 4 on here. I'll take 2 off right now. Now, here's the thing when you do combination. You have to be mindful of your connectors, because the connector, you have a 1 channel and a 2 channel. Combo only works with 2 channel, the channel number 2. We're going to unplug channel number 1. And then I'm going to just take a look and see which pads I'm going to disconnect. So these are the pads here that we don't need. We're doing combo therapy. Now, channel number 1 won't even work with combo therapy. It's just designed to only work with one of the channels, channel number 2. So now that I have channel number 2, it's flashing. Now you can choose combo therapy, ultrasound and stim, with any stim that you want to do it with. I'm going to do it with EMS. You can do it with interferential TENS, Russian, or EMS. I'm going to do EMS. It's really strong. You got to be careful when you start doing it. So here's my 2 pads, and we're in combo right now. This gives you parameters if you want to mess with the presets. Now this starts flashing, and you can see if I dial this button right here, you see where there's different presets. I'm keeping it simple, leaving it on number 1. And once you start, what you want to do is you want to bring in the, see, this button number 1 channel has no effect because we disconnected those. This is the channel for ultrasound combo. So now we're going to go ahead and start turning this knob, and you can see in this area, this shows you the settings for the ultrasound. I'm going to go ahead and start doing it, and I'm just going to keep turning. Bring this a little higher. So I'm dialing up the voltage on the ultrasound pads. Oh yeah, I feel that now. See my hand? Now, the ultrasound is set to what I had it before when I was just doing ultrasounds, 100% duty cycle, and the treatment time was 5 minutes, 1 watt. This is the intensity of the ultrasound, and then you can see the, this gives you the parameters for electrical. And my hand's going crazy here right now, but this is basically how we do combo. I chose EMS. You can choose, again, interferential or TENS or EMS. That's a doctor's choice. I really feel that in my arm. It's strong. So I'm going to go ahead and stop this. Pause. Whenever you have a parameter that you decide, for example, here's P1, program 1. We can go to, for example, program 3. Okay. Now we're still in combo mode from before, but if you were to make any changes to, let's say, the time, right now it's on 20, okay, and I'm dialing it down to, let's say, 12 minutes, just as an example. When you hit this button, as long as you don't increase the intensity on either the ultrasound or the stim, you're still in programming mode, preset. When you hit this, it will save your changes, and I believe it will keep those changes until the next person comes along and makes a new change. So when you go back into, let's say, P3, the previous change is stored by hitting this button. So this button here acts as a storage of a change in a parameter or a program, or it acts as a button to stop therapy in the middle of anything that the patient is receiving. So it's a dual button. Now, we're going to go back to program number 1. Oh, I'm still in, okay. Now you can change the cycle. Let me just go back to here. 2, 1. We're back in program number 1. Now this button, the ultrasound button, is a like a volume control knob where it increases and decreases the intensity of the application, the intensity of the treatment. It also acts as a push button where you can switch or toggle between watts or watts per centimeter squared. And you can see we can raise the watts, or you can go back to 0 and raise the watts per centimeter squared. I'm not 100% sure, but I believe that affects the treatment area. It might be making it wider or smaller. I'm not 100% sure. If I had to, I would go online and look that up because the book certainly does not tell you. Pause. We've been in combo mode now for about 5 minutes. When you want to get out of combo mode and go back to either ultrasound alone or stimulation alone, electrical stim, you go back to your button number 1 because that gives you the treatment protocol. And you could see we went just to TENS or just to ultrasound. So we're going to, and back, it toggles back to combo. Now right now I'm in electrical only. So this is the button where you rotate like a volume control knob where you can change interferential, 4 pads, 2 pads. Now, when you're in this mode, these other buttons that I didn't even mention, there is a cheat sheet that you can see or use to change all these different parameters 1 box at a time. I would suggest sticking with the presets unless the doctor explains to you what he wants or she wants. That's what these other buttons do. This button always changes the time, and I'm going to show you here. The treatment time is dialed in as 15 minutes. When you tap that, we're in interferential 2 pads. As soon as you tap that, this flashes, and it gives you, by flashing, it tells you what you're changing, and then you can dial in higher or lower treatment time. Okay, and again, anytime that you make a change, you can save the setting, or if it's a one-time change, and you know, let's say you're doing 6 minutes on a patient, and you don't want it to stay 6 minutes forever, don't save it. Just go ahead and start raising the intensity on the pads, and then when you stop the treatment, or the treatment stops automatically, it'll go back to 15 minutes, like the previous times. Pause.